Hello, everyone. Thank you so much for joining us for this edition of Talkin Kids Health. I'm Beatriz Canals, and joining me today is Dr. Marcos Mestre. He is the Senior Medical Director of Pediatric Services here at Nicholas Children's Hospital. Thank you for being with us, Doctor.
It's great to be here, Beatriz.
We want to mention we'll be discussing today the pandemic, of course, the way that it's affecting, in particular, our children in the community. But because we want to adhere to the rules and what we should be doing to try to stay safe, I want to mention Dr. Mestre and I are not wearing our masks, but we are seated 6 feet apart from one another. So We're doing that so that you can understand us hopefully a little clearer than if we had our masks on. Now, doctor, unfortunately, we know here in South Florida there has been an increase in cases when it comes to adults. What's the situation when it concerns our children?
So we're definitely seeing an increase in cases as well in children. Across the state, the average percentage of positive tests that we're seeing in children is about 30 to 33%. That's very similar to what we're seeing here at Nicholas Children's Hospital. We're testing all of our patients that require an operation, patients that are admitted to certain areas of the hospital, patients that come in with symptoms that may be consistent with COVID or have a COVID exposure that are presenting to our emergency department or our urgent care centers or even our clinics. And we were seeing about a 31% positivity rate since June 24. So about the last 3 weeks, our positivity rate has gone significantly higher. Just to give you an idea, before June 24th, our positivity rate was 3%. So you can see the significant rise in cases that we see, and that's mirroring what we see in South Florida in general in the adult population. Thankfully, though, many of these children are either asymptomatic or have very mild symptoms, and they recover very well in a short amount of time. There are some cases, though, that are more severe that develop either a pneumonia, have a gastrointestinal symptoms that need to be admitted to the hospital for a short period of time. But in general, those patients are doing very well and recovering in a quick manner.
When we talk about the symptoms, tell us if you can, what are the most common symptoms that you've been seeing in these children, and what should parents look out for when it comes to symptoms?
Sure, that's a great question. And what I always recommend to parents is, number one, always trusting your sixth sense. As a parent. And the main symptoms that we're going to see when we have these patients that come in with typical type COVID symptoms are going to be mainly cough, shortness of breath. Sometimes they may have chest pain. Obviously, fever is one of the most common symptoms that we'll see across the board. But then there are some symptoms that are not as common but may present, especially in adolescence. We do see the loss of taste or smell. For those patients. Some patients may present with gastrointestinal symptoms, so vomiting or diarrhea, and they will also could have some rare symptoms, maybe a headache, some neurologic type symptoms, but those are more rare.
Doctor, what is your advice for parents who do detect these symptoms and they fear their child may have contracted COVID-19? Should they call their pediatrician, take the child to the hospital? What is your suggestion?
Sure, and I always recommend to have that good relationship with that pediatrician of the child. So at first, if there are any symptoms of concern, to contact your pediatrician. Some pediatricians might not be able to see you in the office if you're ill just because of the concerns of having a smaller waiting area or whatnot, and they may recommend that you go either stay at home and treat the symptoms at home, or come into one of our centers to be tested at the urgent care centers, or even if the child is more ill, to the emergency department. And what I always want to harp on for parents is all the measures we've taken here at Nicholas Children's to make this as safe as possible for the parents and the children. All the measures we take in terms of making everyone wear a mask, the temperature checks, the screening questions that we do when everybody comes in. So not to delay the care, if you feel that your child is ill, to come in and get checked out.
Now, Dr. Mestre, when it comes to children who do contract COVID-19, there's a secondary condition, if you will, that you're seeing in some kids, which is an inflammatory reaction. I believe it's known as a multi-system inflammatory syndrome. Talk to us about that, and what do you see in children that develop this?
Yeah, so multi-system inflammatory syndrome in children, otherwise known as MIS-C, that's the acronym that we've been using. Initially was picked up in children in Italy, the United Kingdom. We did see it more so in New York when they went through their rise in cases. And we did see a rise in cases, especially in May, here after the initial portion of infections in April. What typically occurs is that a child may be infected with COVID, and then about 3 to 4 weeks afterwards, they develop an inflammatory response that causes them to have symptoms such as a fever, rash, redness of the eyes, swelling of the hands and feet, redness of the hands and feet, cracked lips, redness of a bright red tongue. Those are the symptoms that we typically see with this multi-inflammatory syndrome. The reason we get concerned about it is because it can affect multiple organ systems. Mainly, the one we're concerned about is affecting the heart with dilatation of the coronary arteries and inflammation of the coronary arteries. Very similar to a more common illness that we see in pediatrics called Kawasaki's disease. But we have seen an uptick in cases, and these children tend to have either COVID exposure or COVID antibodies in their system, which indicates that they had an infection in the past. Some children have no recollection of it ever being around somebody who had COVID or any type of COVID symptoms, as many children may be asymptomatic. Just because your child hasn't had any symptoms in the past doesn't mean that they cannot have this multi-system inflammatory syndrome. And what I do want to relieve a lot of anxiety for parents, this is very rare. So it's not common that children that have a COVID infection will develop this, and it's incredibly rare to develop it. But in case you were to see these symptoms, to make sure that you do get evaluated.
And what is the treatment like for that condition?
So the treatment, typically those patients will be admitted to the hospital, and they'll be evaluated by our specialty teams, which include our infectious disease team, our cardiology team, and maybe even our rheumatology team. The reason we get all those specialties involved is because it's a multifactorial syndrome that causes inflammation throughout the entire body. And typically we use a medication called IVIG, immunoglobulin essentially, and that controls the inflammatory response we see in others that have this multi-system inflammatory syndrome. Other medications that we tend to use are IV steroids, again, to decrease the inflammation in the body. And if we really need to treat this for more severe cases, we use medications that are classified as immunomodulators, again, medications that control this inflammatory response across the body.
So while this is rare, which is good news for parents and for children, the good news is that here at Nicholas Children's Hospital, I know you do have very much a multidisciplinary approach to treatment of all sorts, but especially this one. So it's great to know that you have that team that can work together to help these children that do develop this rare secondary condition, if you will.
That's right.
When it comes to looking towards the future, I know as a mom myself, my greatest concern now is with our son, school is approaching. For some kids, it's less than a month away, especially the little ones. You worry, what should they do? Of course, most are waiting to see what the school system will end up deciding to do, but what are your thoughts on that and whether kids should go back to school or what parents should follow?
Yeah, so it's not an easy question. I always say this is definitely a relatively individualized question for every family and every city across the country. Obviously, in a city like ours in Miami, where we're seeing a significant increase in rates, decisions might change as time goes on. The recommendations of the American Academy of Pediatrics is to try as best possible to get children back in school, but it needs to be done in a safe manner. There are certain schools that may have different capacities in terms of being able to do the appropriate social distancing, making sure everybody's wearing a mask, making sure that everybody's washing their hands, or even having the capabilities of having classes outside, which will decrease the risk of passing on the infections. Now, the one thing that I always want to make sure of is, in general, the kids will do very well, even if they were to get infected, but I always worry about the teachers as well, and making sure that they're protected, making sure if somebody's of an advanced age or if they have any sort of immunosuppression, both teachers and children, that may be a situation where remote learning may be more feasible and better for the families. But again, this is very individualized, and as time goes on, we'll have a better idea of what we recommend. But at this time, we'd love to have everybody back in school in either a full mode or a hybrid mode. But again, realizing that if it cannot be done in a safe manner, then we'll have to go back to the virtual learning, at least temporarily.
Doctor, I'm curious, for the main caregivers for children, a mom, dad, whomever is most with them or with them at all times, if it's in many cases it's both, if one or the other caregiver is found to be positive for COVID-19, do you think the child should automatically be tested? Should everyone in the home be tested right away?
That's a great question, Beatrice, and it depends. For those situations, what we typically recommend, once one member in the household is positive, we recommend that everybody in the household be quarantined. So at least for in between 10 to 14 days after the onset of symptoms, that we recommend quarantine of those members within the household. Now, it's not to say that the child shouldn't get tested if for peace of mind that they want to get tested, even if they're asymptomatic, they can. Obviously, now with the testing, we're trying to reserve that for those who specifically need it. And the testing results, unfortunately, now, especially if it's done as a send-out test, is taken up to 10 days to get the results. So sometimes you'll get the result after the end of your quarantine. So what we recommend is once one member is positive in the household, assume all members are positive in the household. And again, to try to isolate those at highest risk from the illness. If you have as we know in South Florida, we have many multi-generational families living under one roof, to try to protect the grandparents that may be at higher risk or definitely at higher risk, or those with any sort of immunosuppressants. And that's one of the challenges as well in terms of going back to school. That you may have a child that might be asymptomatic, but again, you need to keep that distance from those at higher risk.
Yeah, when you mention that, of course, on our mind always the abuelas, the abuelos that we want to take care of and make sure they don't catch this virus. Because we are seeing an increase in the number of children, we came together to discuss this today, primarily because we want the community to be aware of what they can do. Once again, I think it's important to keep repeating it, Doctor. What can we do to try to keep not only our children, but the adults, all of us, from contracting this virus and to keep the numbers down? Talk to us about the importance really of wearing the masks and all of the other procedures that we should be following.
Sure. And again, especially now with what we're going through in South Florida, it's not to let our guard down. Just because most people end up doing well doesn't mean that we cannot affect those that might not do as well. And from our standpoint, it's just being a good steward in your community and making sure that we're wearing our mask, standing the 6 feet apart, and not getting in large groups under one roof, trying to limit those situations as much as possible. And again, what we try to do is limit the risk for others that are going to be at higher risk for these infections to contract the infections. Right now, we're seeing our hospitals being overwhelmed in the city. And we want to make sure that we give our healthcare workers the capabilities to treat these patients in the appropriate manner and do so without being overwhelmed. And that's the main crux of this argument, is try to control it. And as we've heard multiple times, flattening the curve. Unfortunately, we've seen this high spike in cases and high spike in hospital admissions across South Florida. And we got to do our best to control it. And we can control it if we do the appropriate measures.
And that's why we're here today, to hopefully get all of you watching this to follow the directions and the instructions until we get to some safe numbers, and hopefully keep the numbers going down rather than up, and to keep our children in the community safe. Doctor, you mentioned when it comes to school, because it is a question that we seem to be getting a lot of and the parents are discussing, follow the safe start to school. Wait and see what the officials decide. Use your common sense and whatever it is individually that you feel safe with your kids. Anything you'd like to add, Dr. Mestre, to parents who are watching now and they see these numbers and they worry about their kids?
Sure, and it's my advice to all parents, and I have multiple friends, as you say, Beatrice, that are asking us the questions, and patience. And my advice is to continue to keep up to date with the latest recommendations. The CDC has been given guidance as much as possible, and in terms of trying to make sure that there is the safety that the school can provide. Every school is going to be different. So at this is the time for parents to ask a lot of questions. Ask those in charge of the schools, the administrative staff in charge of the schools, what are the measures that are going to be taken? And then in the end, it is going to be somewhat of a personal decision. It's a tough balance because we all see the benefits that it has in terms of going back to school, from a psychological perspective, from a social perspective, families that have both working parents and can be at home with the child. So we're doing everything possible to get our children back to school, but it has to be done in a safe manner and where parents feel safe in terms of caring for their child in school. And what I always say is not to pass judgment on anybody. Everybody's going to have to make their own individual decision. And for the schools to provide that safe environment is what we're going to try to get to.
And what we can all do together is, as Dr. Mestre mentioned, wear our masks, try to avoid large groups, wash our hands as often as possible, set the example for our children so that hopefully they will follow it as well and make sure that they're following that as well so we can all stay safe. If you'd like more information on all of this, as Dr. Mestre mentioned, it's important to follow the CDC's instructions, but also here at Nicholas Children's Hospital, they have wonderful information for you on when it comes to COVID-19. All you have to do is log on to nicholaschildrens.org/COVID-19. Again, nicholaschildrens.org/COVID-19. All of the information, some tips for parents to keep their children safe. Thank you again for joining us, Dr. Mestre, and for all of you who joined us on our virtual world. We thank you for joining us, and we hope to see you next time on Talkin Kids Health. Please stay safe and healthy. Take care.